Thank you for being here. Welcome to Fertility Talks. This is live post number 148. And I'm Mary Wong, founder of Alive Holistic Health Clinic, author of Pathways to Pregnancy, and your fertility strategist. Tonight, I am honored not just with one guest, but this is actually my first time interviewing two people at the same time. So I want to welcome Dr. Baratz. Welcome.
Thank you, Mary.
And Sophia Zhang. And before I go into the depth of our conversation, which is basically once you get that positive pregnancy test, what the heck do we do? Like, now what, right? But before we go into the meat of that, I just want to express to you that Fertility Talks was basically created out of a need to create content that is based on the latest research and professional, like experts' opinion and personal stories as well, so that they are, they're resources that you can count on versus just dabbling on Google, Dr. Google, which may provide you misinformation. So I really, again, want to thank you both for joining us, because it's like 8:30 at night and we all worked, and this is like a free resource. So really, I want to thank you guys. And I also want to comment that I love it that we're all wearing red for Valentine's Day in honor of Valentine's Day, red/burgundy. Thank you for being here. Okay, so we're going to get right to it. Oh, actually, hello. You guys need to know who these people are, these lovely faces that you're seeing. So I'm going to start with Sophia. Sophia Zhang is a McGill-trained dietitian who specializes in weight loss, preconception health, pregnancy and breastfeeding, and chronic disease management. So besides operating a private practice, she also does research on the effects of diet on reproductive health. And I just found out that Dr. Baratz knows Sophia because you guys, is it true that you worked on research together at Create, where you worked, Dr. Baratz?
Yes, we worked on some groundbreaking research along with collaborators from Montreal, McGill University, looking at not only the impact of supplementation on the current generation, but the impact of supplementation on grandchildren generations through male health and female health. So looking at the impact of folic acid, actually.
Oh my gosh, that's awesome.
Very exciting research that has many aspects to it, and perhaps Sophia might comment on a little bit, but that's where our collaboration began. And certainly we have a very active clinical relationship. And I think it's really important for any person going through fertility care to access a registered nutrition dietitian expert, because they really provide a wealth of assistance before pregnancy and certainly during pregnancy as well, like what we're going to talk about this evening.
Absolutely. And I love how you say before, because really, as I always say, when you cultivate this, when you plant a seed, you need to cultivate the soil first, right? So same with pregnancy, you want to cultivate the nutritional values into your body so that your body, when you conceive, you're already in a good place, right? But we are talking about now you're pregnant. And so there's a whole whack of questions that goes along with it. And again, I did not tell everyone who you are, Dr. Baratz, but I've had the honor of already interviewing Dr. Baratz earlier, and amazing interview. You're a wonderful speaker and highly informative. So I thought, let's bring him back because we've got to do that. So thank you. And just as a side note, he is focused on providing patient-centered fertility care. Dr. Baratz's clinical interests include providing all forms of assisted reproductive technologies and reproductive endoscopic, minimally invasive surgery. And he's a compassionate practitioner and dedicated researcher, as you just hear. And he has presented his research at several national and international forums. He has a special interest in reproductive telemedicine, that is Ontario Telemedicine Network. That I did not know. That's really cool. And so you do consultations through platforms like, so what, is it like Skype or something that you do?
Yeah, so we provide at the Create Fertility Center, where I'm based, we provide care across the province. Actually, we provide care nationally and internationally via telemedicine networks. So it's very exciting to help people, not just in our immediate community, but around the world, actually.
Absolutely. So the rippling effect is large. So thank you for providing that for everyone. And so now you're going to even contribute even more to provide us information about what are we doing when we get the, okay, I got a positive, right? Because for anyone who's been trying for some time, it's a huge concern. Like, yeah, you get pregnant, you worry about getting pregnant, but then once you're pregnant, it's like a whole other lot of questions. So let's start asking, is there anything I should not eat? So we'll start with you, Sophia.
Yeah, so that's probably the first question that clients ask me. Is there anything I should avoid? So there is. So any raw food should be really prepared and eaten very carefully. So for example, if you order a steak, ask for it to get well done. And if it's an egg, make sure it's well cooked instead of the yolk running. And of course, like there is some raw foods that we can't really eat cooked, like fruits. But just make sure that you wash it very, very well. And you know, if even if, or especially if it's organic, because organic produce use organic fertilizers, and they're also at risk of foodborne illnesses. And if you're a big salad fan, I usually recommend being very careful with salads. So if you want to be on the precautionary side, just avoid salad and eat all vegetables cooked. If you really can't give up salad, I would say avoid leafy greens because they are at the highest risk. I don't know if anybody remember, like for several years consecutively during Christmas break, there is E. coli outbreak that happened with lettuce. So yeah, it's especially harmful for women when they're pregnant. So that's one group. Soft cheese unpasteurized is also best to avoid for similar reasons. And the second group of food is seafood high in mercury, which might be more well known. And then people should avoid too much caffeine intake. So the official guideline is about 2 small cups of coffee, less than like 500 ml per day of coffee. But some clients would like just to take 1 coffee a day, which is better, or even none, because there is really conflicting research, and then even different countries are disagreeing with how much is too much. Some countries recommend less, some countries recommend more. In Canada, we say 2 is max. And the last group is herbal tea. So there are a lot of herbs, even uncaffeinated, that could lead to negative consequences. So unless you're talking to somebody really experienced, just avoid most herbal tea. And what I would recommend are always safe are lemon, orange, ginger, rose hip. Yeah, those pretty much like natural food teas. Food you would eat otherwise as well. So those are safe.
Do you have anything to
Mary, you have?
Yeah, of course, I'll have something to say about that as well. But how about Dr. Bratz? Anything to add?
Well, just a general comment, which is when someone finds out they're pregnant, the term I usually use to describe that situation is cautious optimism. I think people should be optimistic. Very often this is on the heels of lots of work, challenges, treatments. It may be a first pregnancy. And so an element of caution should definitely be applied across the board, whether it comes to diet, activity, decision-making. And so my point being that sometimes people become overly bold in early pregnancy, wanting to make major changes. And I always suggest to them that it's one thing to sort of pull back diet. It's also another thing to add on new things. So perhaps experimenting or being too bold in early pregnancy is something you'd want to be cautious with. For example, let's say we're having a lot of issues with diet, as opposed to exploring and trying all these new things, look at what you do tolerate and then maybe use a nutritionist dietitian to help you test the waters. And that comes with activity too. People all of a sudden start new programs when they've never been on a program before. So in addition to what Sophia was saying, I caution people against making bold changes when, you never even know, maybe they'll have a sensitivity to a food that they've never explored before. So really keeping it simple, whole foods, fresh, and sticking to Canadian health guidelines that either one can explore on their own or through a professional.
Love it. Very good. I'm going to make a comment with regards to coffee, and you're totally right. And actually, I'd say that a lot of women, they kind of stop wanting coffee. It's like the desire is less. And in my book, I actually mentioned coffee too, but really, like a lot of the guidelines will say something like 200 milligrams. But the comment about the 2 cups of coffee, it's very hard to tell because here's the thing: we have different coffee beans, different coffee makers. So we actually really don't know how much caffeine we're getting through 2 cups of coffee, right? So if we're not talking espresso from Starbucks versus Tim Hortons, there's probably going to be different grammage, right? So use common sense, as Dr. Barat says, and also like your personal, just check in with yourself. Like, do I really want this coffee? Like, how is it making me feel? I might actually feel pukey even smelling it. So anyway, whatever it is, but not to, like, I believe that it's important also to be balanced and not be overly rigid in our diet too, right? Like we want to follow and do everything to a T, and then we lack joy in our lives, and I think that is cause for major depression, really, and we know that that can be a possibility when it comes to fertility. So we don't want to overdo either. Does that make sense?
Yeah, but Mary, we do have to be careful because early pregnancy is what we call in medicine an immunocompromised state. So women
Yes.
are more exposed to infections. Their immune system is just not functioning the way it normally does. So if there are foods that elicit immune response, you would be an expert as well, Sophia. They really should be cautious in that area. So as I said, it's not just common sense. It's also using the professionals around you and taking stock of what's worked for you in the past. I mean, now that you're pregnant, now that one's pregnant, I think that's exciting, but it's not a time to throw caution in the wind and forget about all the things that you've tolerated for the last, 20, 30 years of being exposed to a normal balanced diet.
Oh, absolutely. So I'm not saying that. So
Yeah.
thank you for adding that in case people actually misconstrue what I'm saying. So no, I agree with you wholeheartedly. Thank you. Okay, so next one. Well, then, of course, this is a good segue into getting enough nutrition. So can you address that, Sophia?
Yeah, absolutely. I think both of you have tapped a lot into that question already, kind of like, 50% of what I'm going to say. So yeah, the biggest message I wanted to say is just not to be overly cautious. Like there is foods that you should avoid, but there are more foods that you should be including. And don't start something too dramatically different. And then also this is not a time for any kind of diet. Just follow, most of what you are doing currently, and then take some steps if you want to improve your nutrition, but not put too much stress on yourself to eat like perfectly healthy all within, a month. Yeah, like we still have time to change a bit of that. And, like if you work with a nutrition professional, then you would be able to, they will be able to tell you, what's the most important thing to add or change right now, and then other things you can just forget about until maybe 2 weeks later. So that's a little easier. But overall, just trying to have a balanced plate. Half a plate of vegetables, a quarter of lean protein, and another quarter of whole grains or starchy vegetables. And also don't forget dairy or plant milk and fruits during your snack time. And also I wanted to stress that seafood is very important, and there is not just salmon within this food group. Salmon is great, but things like mussel, shrimp, clams are very, very nutritious, especially during this time, and should be included as well.
Yeah, but I would actually make note of sourcing the appropriate salmon if we're going to look at salmon, right? Because there are certain ones that have higher contamination. Do you have thoughts about specific salmon?
Yeah, I think it's the specific salmon is hard to find actually, so I am actually not going to comment on it because I haven't found it in grocery stores here. Basically, it's wild caught Atlantic salmon, I remember, but I couldn't find it. It's like always farm raised. So in my opinion, just have a variety of seafood, and then salmon in general is not high in mercury, so it's nothing to worry about. But if you have one portion of salmon per week, and then two other seafood, low in mercury other times during the week, then your diet would be full of seafood, and you're getting the nutrients.
Okay, so then here's a question. How about if you're a vegetarian or you hate seafood?
Good question. Yeah, good question. So if you're vegetarian, then that's fine. Just skip the seafood. You can get omega-3 from flaxseed, omega-3 enriched eggs. Though there is argument that there is not too much DHA in the plant-based omega-3 sources. So if that's a concern, you could get a supplement of DHA. So it's not essential because there's lots of vegetarians, and there is no data showing that it's harmful not taking the supplement.
Okay. Any comments, Dr. Baratz, on this?
Thank you. Well, very often, when pregnancy occurs, it is a different physiologic state. There's a massive number of changes occurring in the female body beyond just the reproductive system. Pretty much every system is under the influence of pregnancy. And that is probably the wrong time to target extreme weight changes. So very often people look at pregnancy at like a new year, like a time of renewal. And there's no question that it is a new state. And very often for people, the first time they've been in that state, but it certainly should not be the time when people are targeting extreme weight loss. People who are obese should avoid extreme weight loss during pregnancy. All of the guidelines, both American and Canadian, on obesity in pregnancy is not you would never perform like a bariatric surgery or any kind of extreme changes during that time. But you'd be surprised, people kind of look at pregnancy as this kind of like almost a resolution time when they decide to cut all exposures. I mean, obviously smoking, drugs, alcohol, definitely, but to cut food would not make sense. We always recommend weight gain during pregnancy. Weight loss is not advocated. That is not normal. It's just the targets for larger versus smaller people are different. So again, back to the comments on what to consume, bold changes are really not, unless they're being supervised, are really not advocated during pregnancy. And one of the phrases I was taught, and I'm trying to find a way to spin it in a very positive way, but grazing is a really good activity, but overeating is not. So we always say people graze frequently throughout the day, but don't try to eat for two people. That's not, that type of calorie consumption, and I'm sure Sophia could comment on that, is not sustainable and maybe even dangerous, especially if someone has a pre-existing condition like hypertension, diabetes. Wrong time to be overeating. It could actually be dangerous.
Yeah, and I love it that you said not eating for two, because that's a myth, right? So it's definitely not about eating for two. Did you want to comment on that, Sophia?
Yeah, I totally agree with that. A lot of women I see, they are just seeing this as a reason to eat more because now I need more calories, and it's not too much more calories that they need. It's about 400 to 500 during the second and third trimester, so nothing at all during the first trimester. Your needs are the same. Mm-hmm. So the main thing is just to, first of all, always follow your appetite and hunger cues, and make sure it's your physical hunger, not your mind hunger, your eye hunger, like when you see something or you're just bored or you're just stressed, you're eating. Yeah, and also portion control is still very important. Yeah, you don't need too much more food, because that often leads to pregnancy weight, too much weight gain during pregnancy, and after that you have to either lose all of the weight, or if you can't, then sometimes women get depressed, which is not great after delivery. Mm-hmm. as well. So yeah, really starting from this time, do eat more food, but not too much.
Well, thank you for, oh, you wanted to add in. Okay.
One of the things I see a lot, because we're usually taking care of patients right from ground zero, right from the beginning, is I see a huge amount of dehydration. And I'm sure Sophia can comment on that. All of us are dehydrated, males, females. The fluid intake requirements are huge for non-pregnant people, and they only stay the same, if not increase, for pregnant people. We talked about changes physiologically. The blood volume increases massively compared to the actual size of the person. And if you increase volume, the only way to maintain that is with fluids. So obviously not sugar fluids, because those are very dangerous. Like soft drinks are so full of sugar. Diet drinks have a lot of caffeine in them. So I just say good old water. Water is great, maybe water with lemon. Very often patients, women in the first trimester suffer a lot of nausea, vomiting, and a bit of spiced water or flavored water can help treat a lot of that nausea. We know that the sucking reflex can actually curb a lot of nausea. So hydration, hydration, hydration is one of my messages to first trimester patients.
Love it. And that is very, very key. Thank you for that. And yes, I have my water here too. Hot water. Being the good Asian that I am, I'm drinking hot water. So, but okay, let's address that water then, because here's the thing too. Sometimes hydration is what you need, but yet like first trimester, sometimes myself included, it's like, ugh, the taste of water really sucks. And like, so what do we do, right? So I myself personally, for the first time in my life, actually drank bubbly water. So not ginger ale, guys, because ginger ale is like total sugar. But bubbly water, add some lemon. Any more comments, Sophia, about that?
Because I found that really works for a lot of people. Yeah. The sparkling water, I don't know what's the magic in there. It worked for me as well, and also for a lot of clients. So bubbly water, also cold, iced, bubbly, or like, either sparkling water or regular water in general helps better. Yeah, and then put lemon, ginger, or just natural orange, any fruit that you like. You can just make fruit infused water.
Yeah, and actually, I like that you said orange, because if you're nauseous, the acidity in the orange somehow helps to temper the nausea. And it has vitamin C, not a bad thing, right? And I also wanted to comment. So I loved it that you both talked about and addressed about not overeating. But then there's a flip side, the concern of, gosh, I am a little nauseous and I just don't have an appetite. So do we worry about that? What are your thoughts and contributions? Start with Sophia.
Yeah. So most people I see, if they're nauseous, there are times in the day that they typically are more nauseous than others. And there are other times during the day that they can eat. So I would just say eat during the time that you're not nauseous and not push yourself to, eat like the big meal when you are nauseous. So yeah, and then overall, the key indicator is weight. So if you're losing a lot of weight, that indicates that you're not eating enough. If you're already gaining a lot of weight during the first trimester, there are your doctor would be able to tell you, how much is the ideal weight gain during each trimester. If you're gaining too much already, then even if you're nauseous or vomiting, that still means that you're eating too much. So I think just monitor your weight, not daily, but at least weekly is important.
And Dr. Baratz?
Well, again, my job is to provide the color commentary on why this is all happening. So one of the reasons why undereating occurs is that one of the systems that is most susceptible to changes in pregnancy is the gastrointestinal system, especially gastric emptying, stomach emptying. And very often, even though women haven't eaten that much, they feel this early sense of fullness. That's what triggers a lot of the nausea, and they feel they can't eat enough, or they just can't get the food in. And so a few strategies are small, frequent meals. So back to the grazing, kind of what Sophia was saying, like eat when you feel like eating. Hydration, and maybe even switching to complex fluids. So instead of eating a steak, which is very difficult to break down, maybe having a soup or a smoothie, Again, there might be more sugar in there, but you can supplement that with protein or fats. So fluids are typically easier to tolerate. And then a lot of it actually starts before pregnancy. So making sure that you're going into pregnancy not on any of the extremes, right? So we talk a lot about people who are overweight, but being too underweight, having a BMI that's below the normal lower limit might put women in a very brittle situation where if they have a few days where they're not taking enough food, they could actually go into distress. So again, working with people like Sophia before pregnancy to make sure you're not in one of those high risk groups, hydrating well. And another key factor is urine output. So how much someone's peeing. Not to be too graphic, but urine output is really important because that tells us, is the body functioning well? Not bowel movements, but I would say more urine output. And if someone is going, a half day or a couple hours without peeing, and they've had lots of nausea, vomiting, it could be they're very behind on their fluids. So not only do they have to hydrate, but they may need to seek medical attention. So that's a very dangerous situation. That's a red flag for us. So all systems should always be working, pregnant or not pregnant. And again, listening to your body, seeing what's normal for you. And if you're too far outside that normal, engaging a professional.
Love it. Okay. We've already covered the nausea. So I want to now go into exercise, and you touched upon this already, Dr. Bratz, a little bit, but specifically, well, the immediate question is, can I exercise? Do I exercise, Dr. Bratz?
Well, I'm a big fan of exercise for a few reasons. Number one, as a human, I believe in exercise as part of, just like we believe in mental fitness, it's part of physical fitness and the mind, they all work together. So I think all people should strive for activity. There's major initiatives across the healthcare spectrum to improve physical activity, and certainly early pregnancy is not immune to that. There are many guidelines currently from Health Canada, American and Canadian OBGYN guidelines on encouraging activity. But one of the common themes you'll see that we mentioned both in the diet, exercise, lifestyle, is pregnancy is not a time to introduce a major program shift. So if you were always an elite athlete, then continuing with a certain level of elite training is reasonable. But if you were really more on the more sedentary side, becoming an elite athlete or Ironman triathlete during pregnancy is the wrong thing to do. We do have professionals in the activity space, trainers, healthcare trainers, health trainers, gym trainers that are experts in how to incorporate physical activity of different levels of intensity. Current guidelines, just a few highlights, they do recommend about 150 minutes a week, even in pregnancy, during pre-pregnancy and early pregnancy and throughout pregnancy. That's about like 5 or so 30-minute workouts. Or you could have longer, fewer workouts if you wanted. Usually we tap it out at 60 minutes as the longest workout. And typically intensity varies based on the individual, but I usually tell people you should be able to talk throughout your workout. That's a safe intensity. And in terms of weights to lift, again, a trainer would be able to advise, but again, not a new weight. You shouldn't be trying to break personal bests during activity. But in summary, definitely some type of physical activity is important. One little caveat, and then I'll let you respond, unless you're in a high-risk group. And that, unfortunately, a high-risk group, there's a lot of interpretation of who those people are. That you'd have to use your healthcare professional to help you identify that. High risk could be either some kind of pre-existing medical condition, diabetes, cardiac disease, or it could be in pregnancy. So developing a problem with blood pressure, blood sugar, or having a pregnancy that is either complicated, perhaps a multi-gestation like twins or triplets, perhaps having many miscarriages in the past might be an example of that. So there actually are lists to how to identify people who are high risk. And if you're not sure, please ask, and your provider will assist you with that. But bottom line, activity is good.
Activity is absolutely good. And so the key points are that, totally do it, but don't start it as a brand new regimen. If you're completely sedentary, you're not going to go and do 5-day workouts, right? When you get pregnant. You might, but they wouldn't be climbing Mount Everest. They would be workouts that were tailored and appropriate for the individual. So when we talk about workouts, that can be anything from swimming, walking, yoga, biking, cross training. We're not talking about extreme workouts like bungee jumping or extreme diving. So again, if you can't
list a workout, that means that you need advice on what type of workout to do. There also are mommy workouts or mommy to be workouts. There's a whole industry around that. There's many online resources. I mean, the beauty of the internet is that if you Google that question, you'll probably find some type of answer. And I'm not saying go to Dr. Google. Like, if you're not sure about what your medical condition is, please, there are certain medical conditions that preclude working out and they're contraindications. But there's a workout for you. You just have to want to do it.
So this is, I'll just bring this in because it's there for me. So a lot of women will get subchorionic hemorrhaging, right? So some bleeding, if there's like a little spotting, how are we going to work out?
Well, that's a very specific question. Subchorionic hematomas, or what we call placental bruises, are a very heterogeneous group. There can be very small subchorionic bleeds, and there can be quite large ones that can compromise a pregnancy. I think if your healthcare professional feels that it is competing with the viability of the pregnancy, that's one of the situations where you would ease off on activity. But incidental placental bruises that are quiet and not growing, are probably a variant of normal and probably a part of normal placentation. So those would not be reasons to stop being active. But again, all my comments must be validated by your healthcare professional.
Of course. Yeah. No, that's great input. Thank you. And Sophia, did you want to add anything to that?
Yeah, just a small piece. I think for people that were previously sedentary and have no contraindications for exercise, I often got asked, because I think in a lot of cultures, it's just they were just told that during the first 3 months you should not exercise or try not to move around too much. And I think it's best to start with light activities when they're not comfortable. So like walking after dinner doesn't have to be intense at all, and but it could be every day, depending on your schedule and depending on your energy level, any duration from 10 minutes to 30 minutes. But I think walking is a pretty safe exercise that anybody could do.
Okay, and I do love the walking thing. And okay, Dr. Bratz, you want to comment?
So, but very often, because we're talking about all women who are pregnant, but obviously women who go through assisted reproductive technologies, IVF, they might be a bit more sensitive because of all the energy that went into that pregnancy. I can tell you that there's really no data set right now that supports lying down after embryo transfer. In fact, we encourage early ambulation, and there might be some physiology behind that because blood pumps better when you're moving. So, I mean, even in the IVF patient, there's many supports for activity. Whatever the form of activity, that's obviously something that is a personal choice. But even in that group, we do recommend being active. Again, patients with recurrent pregnancy loss, patients on specific medications may need to be careful what type of activity they do. And certainly always checking in with your previous medical history. So if, let's say, you were a diabetic and all of a sudden now you're becoming a little more active, you could have issues with glycemic control if you don't make the proper dietary changes, medication changes, because again, pregnancy is another physiologic challenge. So I'm not saying throw all caution in the wind and just be active, but also be smart. Even light activity, light's a bit of a subjective term, may still require people to rest more. People who are typically more active and in good shape may find that they just can't hit their personal standard, and there's nothing wrong with that. Usually, we have a saying, no pain, no gain. People work through, they train hard, and many fit people will keep working hard despite fatigue. Pregnancy is one of the situations where if you're getting fatigued during a workout, you must pull back, take a break, ideally work out with a partner so someone can gauge your fitness and how well you're doing during the exercise or activity.
Yeah, thank you for saying that, because I think that's so important, because there are some women, they'll say, oh, but I feel bad, I need to work out. And I'm like, you know what, listen to that body. If your body is like, if you're really tired and they're like barely hanging on while they're working and they're going home and they want a nap, it's like, go for a nap, it's okay. You're growing a live human being and you're creating and building blood vessels and creating placenta. Of course you're going to be tired, right?
Yeah, I've taken care of some of the most elite athletes in Canada. Olympic level people, people who have enough hardware from medals that it's very impressive. And these women obviously make a living off their training, and it's a critical piece, but they find a way to balance. And these are people who are in the elite category of athletes, and there are other challenges. It's not just physical; it's also mental. When you're used to training a certain way, 2-3 hours a day, 8 days of the week, there's some counseling that's required around that to help people understand how to modify that workout. There are a lot of also body image concerns. So many women that either have a pre-existing issue with eating challenges, either if they're athletes or actors or models, sometimes there are some, it's not just a physical diet calorie thing. There may be a psychological or psychiatric component that needs to be addressed. And so we're very sensitive to that in my practice, and I believe in your practices too, that it may not just be about modifying the activity. There may be some kind of therapy component as well that's required.
That's great. I love that you're addressing that too. Anything else to add, Sophia?
Yeah, I think that's pretty much everything I wanted to say as well.
Awesome. Okay, so you were mentioning that in terms of your research, you looked at folic acid. Is that right?
Yes.
Am I correct?
Yeah,
So let's address that. Like early pregnancy, PregVit 5 is literally 5 milligrams. Like, do we need this during our first trimester?
so for women, yes. So you need 500 micrograms of folic, not 500. The recommendation is 400, but I know most of the supplements contain 500 to 1,000. And yes, you do. And it's good to take that throughout this journey, like before pregnancy until, when you are even breastfeeding. So that is one supplement that I would recommend you to keep.
And sorry, you said it at 500? No.
400 is the recommendation, but most multivitamins, like for the pregnant woman, contain more than 400, which is there's no harm to that as long as it's below. Like most of it has contain a safe level. It's I see mostly 500 to 1,000. Okay. Which is okay.
Because a lot of people, they'll do a lot more than that, right? So then during pregnancy, my point of view is to decrease it when they're pregnant. But definitely keep it because you don't want to have any neural tube defects. Yes, Dr. Brown.
Yeah, 1,000. Oh, sorry. Yeah. I just wanted to say, sorry, 1,000 is definitely okay, but I know there are if there's medical issues, it's not really considered a supplement. Sometimes it could be a medication. Then that level could be much higher. And also for people that are at a higher weight, their needs might be a little higher.
Dr. Bratz?
Well, I was going to say our research was novel in that we weren't looking at females, we were looking at males.
Yeah.
Folic acid supplementation.
Oh, yes, of course, and males need it too. Okay,
Isn't that
cool.
interesting?
Well, no, I knew it, but so they'll tell. Are you allowed to say? Can we talk about that?
Well, Sophia was one of our point people on the research, but what I'll say is that, like they say, it takes a village to build a project, and pregnancy is no different. I mean, we at the end of the day, we still need both male and female genetics, even though a lot of our talk is about the burden of females, but there's a lot of good data, and our research supports that pre-pregnancy preparation, certainly on the male side as well, may have huge impact on sperm quality and sperm performance and for generations down the road. So I'll let Sophia comment because she was really one of our key players in that research. It's so exciting.
Awesome. Yeah, and I do want to hear you, Sophia. And I just want to say, so for the women that are watching this, bring your husband in on this conversation right now, because what I hear often is the guys just kind of like, oh, my sperm looks good, I'm not going to do anything. So, but if you have professionals like Dr. Baratz and you, Sophia, they might actually listen. So bring the guys in. So what do you want to say about that, Sophia?
I can talk half an hour about this. I am so excited that Dr. Baratz brought this up because yes, like before the women get pregnant, it's 50-50. The man is no less important than the women. And, the better physical health the man is in, also lifestyle, nutritional status, the better the quality of the sperm, and then the better genes will be passed on. So yeah, it really is essential, and it's also a good time, I guess, for it's like sometimes it could be a couple bonding time. I found that both are together trying to improve their lifestyle, supporting each other, not just kind of having one person doing it all alone and doing all the work. This is where the husband could be supporting the wife, or the partners supporting each other.
Yeah, and I love it that you bring that up. Yes, Dr. Bratz?
Well, what I was going to say is, even though earlier on, can you hear me okay?
Yeah, absolutely.
Even though we said earlier on that early pregnancy is not the time to be bold in terms of diet changes or exercise changes, except for lifestyle changes, obviously smoking, drugs, or alcohol. But pre-pregnancy, that is the best time to be as bold as possible with lifestyle changes, supplementation, exercise. Like that for me is what we work on a lot with patients. Because I see there's two ways of organizing the patients I meet. I do meet a lot of people who are currently dealing with subfertility, infertility, recurrent loss. But I meet a group of people, both men and women, who are preparing. They're coming for preconception advice, much like you do. And that is a ideal time to implement change. And not only does that change help you as a person, it will help your pregnancy, performance in the pregnancy. All of the metrics are better in pregnancy. Your children will do better. Their children may do better. So that's a great opportunity. And I really hope healthcare professionals who are listening to this jump on that. And usually it's actually not in my office. It's typically in the primary care provider or the primary TCM provider who's seeing the patient right before they're starting, when they're in this pre-contemplation phase. So I hope as a collective team, we can make those changes before we get into trouble.
Love it. And, I love it that you say as a collective team. There's a Dr. Magarelli, he's an RE from Colorado, and he talks about one medicine, and one medicine meaning the collaboration of different types of holistic medicine with traditional Orthodox medicine, right? So thank you for addressing that. And I actually do cover this in my book. And what you're addressing to is also epigenetics, right? The new science of epigenetics and how it impacts the future generations. And that's exactly what we're talking about. The lifestyle, the environment that you bathe, every 50 trillion cells in your body is impacted by everything that we do, everything that we ingest, the environment that we live in, right? So it's so important preconception wise. And for follicular genesis, we're looking at, 3 to 4 months and really longer, right? Because there's germ cells that sit there dormant for a while, but who knows? Like our lifestyle may impact that too. Not sure.
Well, we know for sure that, let's say smoking, for example, even a few years of smoking can significantly impact the egg pool that's available. And that's just one example. So, very often people feel, oh, I'm doing this, stopping, it's not going to have any impact. But there's massive impact now and in the future. Very often building a family has no upper limit. Some people want 2 or 3 kids, but that's compromised by earlier decisions. So I can't stress enough those lifestyle changes and their near and far impact.
Yes. So I really do hope men are watching this, because oftentimes it's like I feel like they're getting the hall pass. And Sophia addressed this a little earlier. It's like, you guys can do it as a team with the lifestyle changes versus the woman just doing it on her own, thinking that, oh gosh, it's all my fault. And meanwhile, the male sperm has 50% of the impact, right?
Yeah. I just wanted to add to the dietary component that Dr. Bratz said. It's absolutely correct that preconception before pregnancy is the time that you should really try to change your lifestyle for the better. But at the same time, just be very careful with fat diets. A couple of years ago, it was juicing. Recently, it's ketogenic diet. It's probably not the time for these kinds of a diet if you're trying to lose weight. It's probably best to stick to the old-fashioned way. Just go back to the root of the food that you're eating, not trying to try anything extreme, and really work on the relationship with food. the more boring way, it takes longer, but it's also the exciting way, because that's typically how lifestyle change stays. Because it's not very dramatically different from what you were doing before, and then you were probably not thinking about miracles.
Right. And that's a great input too, because of course, when we're looking at lifestyle change, it's really consistency over time, little things consistently over time that can make a dramatic impact and transformation versus just that temporary fix, which is not what you're wanting and not what we're looking for when it comes to creating life and just, overall well-being, right? Any more things to add to that, Sophia or Dr. Bratz?
Yeah, I just have one more thing to add. So our research team has also found relationships that between men that have reproductive issues and then their cardiovascular health in the long term. So it shows basically that if at an early age they are having trouble conceiving, they're at a higher risk of having cardiovascular diseases. So that's another reason why this is a really good time to change your lifestyle, because it kind of just tells you that your body is not at the best ability to do its things. So if you change your lifestyle now, it might actually reduce your risk. It might reverse that, higher chance later on. So yeah, if you need another kick to, improve, then that could be it.
So that's great. So your point is that the subfertility for men can be a marker for cardiovascular health in the long run. So it's a great impetus to change, right? So that, because you want to be around for a while. Like, there's one thing having kids, but you better be around for this kid. So thank you for that. Dr. Bratz, do you want to add to that?
Well, again, just we're talking about simple changes because at the end of the day, all of us, Mary, Sophia, myself, we're all available to help people in this journey. But the best would be if people could treat themselves, if we didn't even have to do anything. So another simple fix that I find is when people are coming in for a second baby, secondary infertility, they always say, "Oh, it was so easy the first time, right? We didn't have as much to do." And then I always reflect back and I say, "Well, are you the same person that you were before?" And if the answer is yes, then obviously I have a lot of work to do. But if they say no, I'm doing this and that, I've gained a little bit of weight, my husband started smoking again, I'm less active, perhaps just reflecting on those changes and reversing them over a certain period of time. I mean, I'm not saying that will cure everything, but sometimes that optimization may lead to spontaneous pregnancy. It may help treat things like blood pressure, PCOS, other pre-existing conditions, and just maybe it may result in a spontaneous pregnancy. So I don't want to take business away from anybody. I want us all to be able to help as many people as possible. But very often just looking in the mirror, not the physical mirror, but the virtual mirror, and just seeing how your life has changed may have some of the secrets or hints to how to improve.
Yes, and really you hit the nail on the head, because we may look at the symptoms, but really the root cause is looking at your own life. And for sure, when you have a child, your life is completely turned upside down. It's very different. And for a lot of women, and men, there's the big piece is there's just no sleep happening, right? For a lot of people. That alone can impact.
Well, I think that's another talk that you're going to have sleep medicine on fertility, because there's a lot of great data on the impact of sleep patterns and male and female fertility. I think you probably should slate that for another evening. But
perfect. Let's do that.
It might not be me, but there's a lot of great experts. I could help comment on that too. But there's some great sleep medicine experts that could comment on that and fertility.
Yeah, that's great. Sophia, did you want to add? Or shall we conclude? We've been like going on and on.
Yeah.
I know. I was like, isn't this a 30-minute? I hope the audiences are still here.
Well, you know what, to be honest, like we want to do it fast, but the thing is when it's an interesting topic and really, I mean, this is their lives, people will continue to listen to this.
Well, also
right?
there's 3 speakers, so we each get 30 minutes. So by definition,
I know.
it should be.
Yeah. Only this way it's fair.
There you go. Okay. Thank you guys so much for being here, taking the time out. And it's like now 9:22. So yes, we've done a lot, but highly interesting. And thank you for doing your research. That's amazing. Is it already out? Is it published?
I believe the dietary part is going to be out soon. The epigenetic part, I am not too sure.
Yeah. Okay. Mary, you're talking, this is part of a major CIHR grant, the male fertility. So there are many projects that are spinning off of what we talked about. Some have been presented at national and international meetings as abstract and oral presentation. Some of it is actually ongoing. So, just stay tuned. There will be more research in that area, but it definitely is out there. And you can, if you're curious about it, you can just Google our names and epigenetics, male folic acid. You'll probably find some abstracts. But yes, it's all going to be in the published space.
Perfect. So you heard it, guys. That's awesome. You know what? I just realized there's a person that posted and she said, I'm 6 weeks pregnant. Can I continue working out with modifications? I've strength trained for 2 years, twice weekly, and have a history of early miscarriages. So you addressed this earlier, but I just wanted to address it specifically for this particular woman. Dr. Baratz? So
again, any comment I make of that specific nature, I would hope that person would see their primary provider, OBGYN or fertility specialist. But in general, early pregnancy loss, like very early pregnancy loss, like less than 6 weeks, typically is mediated by embryonic issues. So they probably have nothing to do with the maternal part of it, meaning you could stand on your head, it probably won't change what kind of embryo is in there. Certainly if this was an IVF PGS normal embryo and still miscarrying, that may be a different issue. But back to our point, so this is the wrong time to be hitting personal bests. But if you like breaking personal records, but if you were someone who has always been very physically active, then vigorous activity would be reasonable. Again, 30 to 60 minutes, no more than 4 or 5 times a week. Making sure that no extreme exposure to heat, so no hot tub steam baths. Weight, again, we typically say even for vigorous weight, like no extreme weightlifting, so nothing more than about 30 pounds in general. That might be very light for this individual. So I think those if you're going to go more than that, I would seek your trainer. And they probably do have a chapter in their book on weight training and the pregnant female, and they can advise. But one of the primary things was to remember why you had that miscarriage, the nature of the miscarriages, and if there's any other existing medical issues, and that will provide the answer.
Okay, thank you so much for that. And just one last comment from me. I talk about in my book, decreasing the impact of stress during pregnancy. So it may not necessarily cause or not cause miscarriages, but it's always good to be as stress-free as possible while you're going through this difficult journey, especially when you've had challenges, right? So it's page 77. We talk about decreasing impact of stress during pregnancy. And then page 78, it's navigating neuroses in early pregnancy. We've got a lot of that going on. So check that out. And just so you know, I'm actually creating an audio version of my book, and that will be coming out in the spring. So I'm excited about that. I'm just like editing it. It's me talking, so you'll hear more of me and it'll be updated as well. And one last thing, February 22nd is the Canadian Fertility Show, and it's at the International Center. It's the 3rd year. Alive Holistic Health has a booth there, and we're actually going to be doing Facebook Live posts every hour on the hour with some of the professionals there. I wish you guys could join us, but it's the 3rd year. There'll be a lot of people. So if you're shy, you don't have to come up, but you can totally come up to the booth and talk to us and ask your questions. And next Wednesday, I'll be interviewing Dr. Jody Peacock, who is actually the founder of the Canadian Fertility Show, and she's a naturopathic doctor, and we'll talk more about fertility challenges in of itself. But we're going to sign off tonight. Is there any one last advice? So I'll start with Sophia, and then we'll close off with Dr. Baratz in terms of speaking to the woman who's just gotten pregnant, what's one thing you want to say to them right now? Sophia.
Oh, you mean 10 things I wanted to say. I'll pick
well, we
one.
said a lot already.
Yeah, so as much as we emphasized, better lifestyle and everything during this time, stress is also very, very important. So I think it's important to find a balance between, changing your lifestyle for this journey versus making yourself too stressed about it. So again, don't overdo it.
Thank you.
If you
Dr.
feel like
Barat?
it's too hard.
Yes.
Well, the first thing I would say is congratulations. Every pregnancy is so special. I would also say happy Valentine's Day because we're approaching Valentine's Day. But I would come back to that basic term that I really do embrace, which is cautious optimism. So this is definitely a time of optimism, positive thinking, positive mind, but caution in what you do, caution in what you eat, caution in how you carry yourself, caution how you deal with your environment. And I think if you marry the caution with the optimism, and you have that general positive attitude, amazing things can happen.
Love it. And I always say cautiously optimistic as well, but caution without paranoia.
Oh, for sure. No, you can't. No one's going to lock you up in a bubble. I mean, that's why I said optimism. You have to be whatever normal means. I mean, you have to, engage your environment, whether it's your work environment, your home environment. But you still got to, look both ways before you cross the street. Those kind of things. Very often, women do describe this kind of brain fog during early pregnancy. So tend to your needs. If you need to rest. If you need to eat. If you need to work out. But still, you got to look both ways. That's my plug.
Absolutely. That's great. And that's the common sense. And then also simultaneously with the common sense, it certainly doesn't hurt to reach out to health professionals, right? To get the right stuff done. So thank you both for being here. Have a great night. Love you guys. Thank you for being here. Thank you for sticking it out with us. And do check out more of our posts because this is number 148. So you can check out lots of posts and you can scroll down. Dr. Barat's has one.
Mary, yes. It's the first ever 2-person, 3-person post. So you have to really promote that because we're groundbreakers here. And I do want to take credit for one thing, Mary. I am the one that suggested we bring Sophia on because I know she's so great. And that's the only plug I want because I was the one that pushed you to bring Sophia on to hold my hand because you wanted me to be the expert on all these things. I said, Sophia knows what she's talking about. And then now here we have this great talk. So I'm going to say goodnight. Thank you so much.
Thank you so much for joining us. And yes, you're right. This is groundbreaking. And I have to say it was a challenge for me, but you guys don't need to we don't need to go there. But I did it for the love of you guys. Take care. And we'll talk later. Okay. Bye, guys.
Bye.
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 Thank you.